Hi, my name is Claude Hemphill, and I've had the privilege for the past 3 years to be the co-chair of the Curing Coma Campaign along with Dai Olson. And I want to welcome you to World Coma Day, and it's my privilege to be able to give you a bit of an update. The question I was posed is, are we there yet? The Curing Coma Campaign at 3 years. Now, I know that many of you are very familiar with the Curing Coma Campaign, but for some of you, this may be new to you. And so I want to start at the beginning. And this really came out of a Neurocritical Care Research Network conference in 2018, where the Neurocritical Care Society was focusing on concerns about the lack of translated treatments for many of the conditions that we treat, and was really looking for the future of neurocritical care research, and used this idea called blue ocean strategy, which is a business model to think about uncontested market space. But as we thought about it, we realized that one of the big issues that we have not uniformly tackled, but that we face in neurocritical care and our patients and their families face, is recovery from coma and disorders of consciousness. So why curing coma? Well, what are the questions that patients or most often their families ask when in the intensive care unit? Are they going to die? Are they going to wake up and be able to talk to us and understand us? Is there anything you can do to increase their chances of waking up and having good cognitive function? These are the questions we, as providers, whether it's physicians, nurses, therapists, get asked on a daily basis, because they are the important questions. They are the ones that matter most to patients, families, and to us. And it cuts across neurocritical care conditions, whether stroke or traumatic brain injury, hypoxic ischemic brain injury, and most of the diseases that we treat in the neurocritical care unit. So what do we mean by curing coma? Well, early on in the campaign, we decided to define curing coma as promoting recovery of consciousness through early intervention and long-term support. So that's really our target. So think coma writ large. And what I mean by that is there are strict definitions for coma that we can read about in textbooks and that we've used for prior research studies. But really, we're talking about the range of disordered consciousness with a focus on recovery. So the Curing Coma Campaign was developed by the Neurocritical Care Society in 2019 as a platform to enable two interrelated goals. The first was focus the science of acute disorders of consciousness on identifying and testing therapeutic interventions. We want and need new treatments for our patients, but also to form an enduring community of medical providers, scientists, and advocates to test and implement these advances. The key takeaway is there's a role for everyone in the Curing Coma Campaign. If you're a consciousness scientist who's looking at thalamocortical mechanisms of awareness, well, you should be part of the Curing Coma Campaign. If you're a bedside nurse who takes care of patients with coma or disordered consciousness, you're in the Curing Coma Campaign. And there's initial seed funding from the Neurocritical Care Society in 2019 to get this off the ground, because this is a grand challenge. And on the right-hand side of the slide, you see some of the infrastructure that we've developed in order to try to tackle this problem. The moon landing is an inspirational thing that's 50 years old and now coming back. But mission control is what we call our executive committee. And there's a steering committee and a scientific advisory council, but the core work is done by modules and working groups, whether it's the member sites group or the community of collaborators or ethics or existing data sets. And currently, we have over 200 active collaborators across these various aspects that span the range of different professional vocations: intensivists, nurses, neurologists, neuroscientists, pharmacists, surgeons, rehab specialists. About half of them from outside the Neurocritical Care Society, and we need more. So that's the point. This is an all hands on deck approach and a great opportunity to come together onto this. So we initially developed a 10-year scientific roadmap. 10 years is probably pretty optimistic for curing coma, but we focused on things like discovery science, clinical trial readiness, and curing coma treatments. And you can see where we are moving along along the map. And now we're beginning and we're into 2023. Common data elements, early prognostication tools, pilot studies. These are some of the important initial things that we are undertaking together. So we set out originally, the first Curing Coma Scientific Advisory Council meeting laid out these scientific pillars of endotyping, biomarkers, and proof of concept clinical trials. And these have really been key as we think about how we push forward in developing the science and the community. Because as we talked about, this is a multidisciplinary effort, a grand challenge, and we're emphasizing the continuum from acute care to recovery. Our patients and their families, their lived experience does not stop at the ICU or does not begin in rehab. It begins at the time of injury, and sometimes it's a lifelong, it never ends. So we've got to work together in order to enable that. So what are some of the things that we've done so far over the past 3 years? Well, engaging the scientific community, and we did this through 2 Curing Coma symposia with the National Institutes of Health, a key partner in all of this. And we really thank Jeremy Brown as our program officer who made this happen along with the Neurocritical Care Society. These are virtual symposia because we were living in the COVID era, but proceedings of this has been published that really identify almost specific research questions that need to be addressed. And then a follow-up symposium and proceedings as well. So if you want to know specifics, just pull the articles. They're open access. They're available for anybody, anywhere in the world. And a number of the other approaches that we've taken has worked through our Coma Science Working Group to identify gap analyses in classification mechanisms, trajectories, and therapies. So a number of other publications. Because if this problem were simple, it would have already been solved. So identifying the scientific gaps that we can then target in research studies has been really a key part of this. And so different aspects that relate to the connectome, that relate to classification, that relate to different potential domains of intervention. And then doing prospective studies. And the prospective studies working group of the Curing Coma campaign come together as a provider survey to understand what's out there now. How are we defining coma? What are the options for treatment that we are utilizing for our patients? And really interesting, one of the gaps we identified early on is, he asked, how common is coma? Well, we have epidemiological data for things like stroke, diseases like traumatic brain injury. And a lot of work has gone into understanding and developing what is the burden of that disease within the society, individually, or the world. But coma, which cuts across diseases, surprisingly had very little data on that. So Daniel Conziella and a number of other colleagues in the Curing Coma campaign did what they initially called the Coma Citizen Survey, used crowdsourcing methodology. And this was pretty cool to address this and published in Brain Communications to understand the cause of, not the cause of coma, but the prevalence and incidence of coma. Trying to get it, helping us classify this so we can understand the burden, which is high. One of the next efforts that's beginning now is a prospective patient level study, COMPOSE. It's the third study from the Curing Coma Campaign Prospective Studies Working Group led by Molly Meetnet and Raymond Hellbach. And COMPOSE is going to be a patient level study. It's just getting started, but it's a prospective observational study of adult coma patients with 2 different tiers of outcome assessed. And this has actually been awarded the Neurocritical Care Society Incline Grant. Chetan Rao of Baylor University is the principal investigator for this. So this is exciting because this study is just getting started now as we're speaking about World Coma Day. Common data elements are a key aspect of standardizing the research approach. Content standards enable clinical investigators to systematically collect, analyze, and share data across the research community. And these exist for a lot of different conditions through the NIH and NINDS, but they haven't existed for coma and disorders of consciousness. They do now. the Curing Coma Campaign through Brian Edlow, Jan Clausen, and Jose Suarez, and several dozen different contributors through 9 working groups, including pediatrics, have developed this. And we anticipate this being published in multiple publications and hopefully put in the NIH CDE repository this year. And finally, World Coma Day. And you're here today on World Coma Day 2023, but World Coma Day is only 3 years old, just like the Curing Coma Campaign. And the idea here is a day for outreach, a day for us to connect, a 24-hour virtual event that allows us to be together throughout that day, public and the science community. And this was kind of an artifact of the pandemic. We didn't have a way to get together normally, so we used this type of virtual platform. And here we are. And so we're continuing this. World Coma Day last year, 1,500 registrants. There's your map on the right-hand side, 100 countries represented, emphasizing stories of hope for patients and families. And there were a whole bunch of milestones in this original lengthy Curing Coma Campaign proposal to think about the first year, 3 years, and then all around out to 10 years. And so in green are those that we have tackled in some fashion. So there's been a lot of work. We're moving forward with this pathway of infrastructure discovery and caring. And there's a lot of plans this year for manuscript publication, but plans for ways for anybody who wants to be involved to be involved. Some people need to be writing the manuscripts. Some people need to be reaching out to stakeholders. Some people need to be contributing to the Neurocritical Care Foundation to improve our efforts to fund research. Some people need to be entering patients in the COMPOSE study. There is an opportunity for everyone. So, are we there yet? Well, I think some of our big goals as we think about the Curing Coma campaign relate to culture change. We are working hard to really make the sense of optimism that when you see a patient in coma, assume their condition is treatable until proven otherwise. This has happened with stroke. This has happened with traumatic brain injury. We know all comas are not treatable now, but we start from a position of assuming so and treating aggressively. This is a challenging culture change. Clinical humility, acknowledging uncertainty while working to lessen it from a scientific and clinical standpoint. The scientific advances are key, implementing new targeted treatments, and really awakening hope for patients and their families, medical providers, scientists, and the public, not only now, but for what we can do in the future. So just remember, NASA estimates over 400,000 people were involved in getting a person on the moon and back, and almost none of them were astronauts. Very few had direct connections to NASA prior to the Apollo program. All these folks working behind the scenes. And that's what the Curing Coma campaign is. It's a grand challenge to fundamentally advance the science of coma and disorders of conscious recovery in neurocritical care patients and implement new therapies to improve their care. It's a broad multidisciplinary effort, which was initiated by the Neurocritical Care Society with seed funding and administrative support. But now we've got to move forward because we're 3 years in, and we've had multiple World Coma Days that have been successful and multiple studies and gap analyses. We're on the road. We've got a lot of collaborators, but we need more. So if you're not already a collaborator, sign up. Submit a story of hope. Every one of us has a story of hope of a patient or family that we've encountered through our clinical care or research. And support the Neurocritical Care Foundation for Curing Coma Campaign research. We are well on the way. And I want to thank you. Part of this is being here together on World Coma Day. Enjoy the rest of the session.